So today we're talking about the 7 things you need to know and master to not hate your nursing job. The reason why great nurses stand out is because they understand these 7 concepts. You might have an idea what a great nurse is, but if you don't understand the 7 concepts, you're not going to be able to close that gap between being a novice to a great nurse. Nursing is a challenging career, and these skills take time and practice when you're starting out. But the good news is there is a quicker way to close that gap. I have interviewed hundreds of nurses and have thousands of practicing hours within my 15-year career. And I have put into practice all these skills that I'm teaching you today. This is what has helped me be that nurse that every patient wants to follow, even after being committed into a clinic for years. I'm telling you, these skills work. And I advise you to stay until the end so you can hear that bonus tip that you don't want to miss. Concept number 1, understand the role and the expectations. At the beginning of your nursing career, you need to understand that you gotta set realistic expectations. If you set your mind that you're gonna know it all, you're not gonna make any errors, everything is gonna be nice and peachy, you're just setting up yourself for failure. Understand your role, understand what the expectations, and set goals that are realistic to you. It's okay not to know it all at the beginning. It is okay. But imagine where you're gonna be 6 months from now, a year from now, 15 years from now. Way different. Author called Daniel Pink that talks about real reasons, deeper reasons for job dissatisfaction. And the reason is because we haven't been able to reach our autonomy, mastery, or purpose. If you understand your role, your purpose, and as time goes by, you master the skill of nursing, your job dissatisfaction will come down tremendously. Concept number 2, learn to listen. Learn to listen. Sit with your patient. Take the time. Yes, you gotta do a med pass. Yes, you have to give a report to the attending or the resident. Yes, you have a million tasks to do. You're gonna be able to understand your patient, which is gonna help you create a better report with the patient. You're gonna be able to create a realistic care plan, and you're gonna have better outcomes. Remember, just take a moment and remember how you feel when you wanna be heard, when you want somebody to listen to you. It feels the world. It feels great when you have someone that's listening to you and they're giving you all their full attention. Concept number 3, know where to find the answers and not know all the answers. Create a resource list or a group of people that you know you can count on whenever you need them. You don't have to have all the answers. You just need to know where to find them. It's okay not to know the answers, but it's not okay to just say that you don't know and not do anything about it. Find the answer. Use your resources so that you can help the patient, guide them in whatever information you may not have. There's no shame in not knowing the answer, but it is disappointing to just choosing not to find the answer. So know your resources, know the people that you can trust and ask them. Humble enough to understand your limitations. Concept number 4, set boundaries, not arrogance. Doctors are your co-workers. Question them. Protect your license. Don't work under any doctor. They are part of the team, and they are as important as you are. So if something does not make any sense to you, question it. You have every right to do so. In the same token, don't be arrogant. Know your place in that team. Again, you're all co-workers. You're not above anyone. Not the PCA or the MA, not the secretary, not the food service. You are a team member. Not beneath, not above anyone. That will help you build harmony, teamwork, and respect among every member of your organization. Believe me, you are going to need that at some point. If you become that nurse that have no respect for other people, or you feel like you're above other team members of your unit or your organization, don't expect them to help you. You'd be surprised how much a secretary, an MA, a PCA, a food server can help you out when you're head-to-toe assessment, teaching, and documenting. Knowing your normal and practicing every single day will become much easier to spot the abnormal. The more you do your head to toes, the more you're going to get comfortable. Take every opportunity you can get to practice your skills. Now, when it comes to teaching, understand that the biggest and most meaningful skill that you could have, taking the time to teach your patient to understand what they have to do, how they have to manage their own health, will make a huge difference in obtaining those outcomes that you set up in the plan of care. And remember, documentation is a legal document that can be used at any point to help other coworkers, other team members know where you're at with the patient so that the patient is not affected. I've created a documentation template that you can use to guide you, and you can find it in the description. And don't forget to wait until the end so that I can give you that extra tip. Concept number 6, change your perspective. Yes, nursing is about caring for other people, but there's still metrics that need to be met. So as much as we will love to just focus on the caring part of it, understand that there's more to it. And if you want to keep the lights on, you kind of have to meet the other expectations, which are your metrics, your budgeting, and all of that comes from the business part of healthcare. Concept number 7, you are making a difference. Nursing is demanding. It's long hours, stressful situations, emotionally and physically demanding. But the feeling that you get from that one patient telling you that the time that you took with them, the education that you provided for them, make the whole difference in their life. They were able to make changes. That feeling, it's priceless. That feeling is priceless. It is what we work for. And I'm not saying that you're going to get that from everyone, right? Maybe out of the 20 patients that you care for, one of them will come back and tell you that. But that one will make a huge difference in the way that you feel about nursing. It will remind you as to why are you doing what you're doing, regardless of how stressful, how demanding it is. Just remember that nursing is a privilege, and you are caring for people that are trusting you. Whether you're a novice or an experienced nurse, you're still that nurse that they're counting on you. You don't have to be perfect. You just have to be that nurse that cares. And we come to our bonus tip. Number 8, create a system. There are some parts of nursing that are repetitive. Our med pass, maybe documenting, maybe the time that you have to give report if you work inpatient, maybe the workflow or the number of patients that you have to see in a day, giving report to providers, doing your rounds. All these things are kind of repetitive as time goes by. Create a system that you follow every time. It will just come to you as a second nature, and things will be less stressful because it's less things that you have to think about. You also want to plan for the worst. Make sure that you go into your room. Make sure that you have all your supplies. Make sure that you have all the things that you need in your nursing bag. You need to plan for the worst. If you're organized and you already have a plan in place, when the moment comes, you're gonna feel like you're in control. Finally, remember to prioritize yourself. Take your breaks, eat healthy, stay hydrated. Take a mental break whenever needed. Practice your deep breathing exercises because yes, we all need them. But don't forget to prioritize yourself. If you don't feel 100% well, do not expect to give anyone else 100%. It's not gonna work. Most people say it takes 6 months to kind of know what you're doing, 1 year to feel like you're competent enough to do what you're doing, and 2 years to be an expert of what you're doing. So you remember that. So whenever you're feeling like you're lost, you don't know what you're doing, why am I doing this? Just remember that it takes time and practice. But if you put into practice these skills that we just talked about, you're ahead of the game. If at the end of 6 months you still feel like you hate the job, I recommend that you sit down and write down what drains the most energy from you. This is a concept that Sahil Bloom talks about, the energy draining. It's not about hating, it's what is it that takes the most energy out of you and what doesn't. You want to focus on the things that don't take energy from you and fix the things that drain you the most. If after doing so, you understand what's draining from you, you kind of understand where you're at and where you want to go, and you're still hating your job, then I will recommend that you look into other suggestions. But before you do so, again, understand what is it that you're looking for? What are your expectations? So that you could look into something that's the right fit for you. Again, find the autonomy, the mastery, or the purpose. This will help you build that job satisfaction. I hope this video helps you become that great nurse that you want to be. And if you want more tips, check out my other videos.